Good afternoon. I'm Wade Fox. I'm the host of Second Opinion, and I want to welcome you to this very interesting session that we're going to have today. I think it's a particularly important issue, and if you're the parents of children in the Westford area, I think you're going to find this very interesting. What we're going to talk about today is a bill H1561, which is in the front of the Massachusetts House of Representatives, and then this is a bill to legalize the recreational use of marijuana. Now, if this bill is passed, it will permit the sale of marijuana for recreational purposes within Massachusetts this year. And this is ahead of the anticipated signature drive in 2016 that is going to try to accomplish the same thing, but it is more driven by what the people of Massachusetts think. This law, if passed, would resemble somewhat like the law that you see in Colorado. And, of course, this is a significant piece of legislation and will undoubtedly have a profound effect on our society, particularly the children that we're going to be talking about. With me today, I have two distinguished gentlemen that are very interesting and very involved in this. I'd like the opportunity to introduce to you at my far right, Mr. Jim Antonelli. Probably all of you know him. He's the principal of Westford Academy. And then I have Dennis Galvin. Dennis is a retired major with the Massachusetts State Police, but more importantly, Dennis also serves on the Westford Planning Board and chaired the committee that drafted the zoning law for the registered marijuana dispensaries that are coming. So I want to thank both of you for coming in and sharing your educational background and on this subject, which I'm sure that there's a lot of confusion out there.
Thank you for having us, Wade.
And so, Dennis, I think I'm going to start with you. And can you tell us a little bit about this bill, a real quick synopsis of how we got to this point?
Sure. You already referenced the bill. It's House Bill 1561. It was sponsored by Representative Dave Rogers from Belmont, along with Representative Pat Jelen from Somerville. And there are 12 co-sponsors with the bill. The bill was filed this year. It's up for debate this time. And as you mentioned, what it will do is essentially legalize recreational use of marijuana. The plus for this, or the proponent's position, is that it's going to happen anyway. Why not take advantage of the revenue? So the big selling point for this is a revenue gain for the Commonwealth of Massachusetts. But our concern, I think Jim is probably the same as mine, is that this is also going to increase supply, it's going to increase availability, and it'll increase diversion as well, which means it'll go to people who we don't want it to get to.
Well, I know that there's probably been a lot of discussion about it, but the level of understanding, I guess is the best way to put it, might be pretty low. And I'm going to ask Jim to kind of explain something. I remember seeing, like many Westford parents, about the fact that they were going to use the Westford school system, Westford Academy, as a research site or project. Probably set off a lot of alarm bells, not really understanding what was going on. Can you explain what they're trying to do and what they hope to get out of it?
Sure.
With this study here in Westford Academy?
Happy to, Wade. And again, thanks for having us here today. Mass General Hospital reached out to us several months ago, two physicians from Mass General Hospital. And basically, it's the first of its kind. And when I spoke with our superintendent, Bill Olson, he was very supportive of the idea that we would come out of the gate as cutting edge to deal with this particular study. There's not a lot of information about the use of marijuana on the adolescent mind. And there was some studies done in western part of the country, but nothing of its kind in this part of the country. And certainly we know the reputation of Mass General Hospital is outstanding, and hospitals in general in this area. Many people come from throughout the world to use our facilities. So this study is really an opportunity, and I support it wholeheartedly as the high school principal, to just, for those that want to be involved with it, this is not a mandatory study. Parents need to understand that if they want their son or daughter to be involved with this, we're happy to have them involved with this. It's a study to make sure that we understand the effects of marijuana use on the adolescent mind, the long-term effects, short-term effects on the adolescent mind, and so forth. There's studies to show today that the brain growth is, for males in particular, takes a lot longer. 25 and 26 years old. So we want to make sure that we really understand and have some good results. Mass General Hospital has guaranteed us that they will provide those results to us, so that it's not going to be something that's going to be secretive in any way, shape, or form. It will be transparent, and it will give us the opportunity to understand really some great science behind this. Marijuana today, Wade, is a lot different than it was, and these two practitioners from Mass General Hospital pointed that out to us.
So I'm kind of in the medical business. I do a lot of studies, and my question is, exactly how is this study set up? I mean, is this something where literally you're going to give recreational marijuana to a certain group of people that agree to it, or how do you distinguish this thing?
So basically, it's students that are going to have to be identified, students that do not not participate in the use of marijuana, those that do participate in the use of marijuana, basically on weekend use and so forth. And so there's really three types of students that will be required for this particular study. Kind of the non-use, moderate use, and high use. And the tricky part about this is that people have to understand that it's going to be completely confidential. And I think some parents will be concerned about the confidentiality. But I really have to emphasize the trust that I've put into these two practitioners that have come forward, and they understand the confidentiality of this.
I'm going to ask you kind of a loaded question, but is there any particular reason why we got selected to be in this? Are we the only school in this, or is this a...
Yeah, we are the only school. It was brought forward to me, several months ago, and I brought it forward to our superintendent of schools. We discussed it. We had a lot of sidebar conversations about this, and then the two physicians came in from Mass General Hospital at one of our recent school committee meetings. We're probably going to do some follow-up with this way. There are still some questions that need to be vetted out and so forth, and so we need to talk about a few more things moving forward.
Well, before we talked about positions and so forth, I mean, there's been a lot of widespread coverage about this. In fact, I have the Sun today, and looking at the initiative and people that really have not taken a stand on it. I mean, there's not an official stand. And I believe the mayor of Boston has come out and said he's going to help the group, or at least lead the group, to oppose this. A lot of it has to do with people's perceptions of what they think they're voting on or not voting on. My question to you is that even though there seems to be a lot of news about this, particularly about the opiate crisis, which I think the governor just had a committee that he formed and so forth, do people really understand the relationship between marijuana and harder drugs, or do people think that it's separate? I mean, this may be an opinion, but I believe it's called a gateway drug. Dennis, you want to take that one?
Well, one of the reasons why, just for the information of the audience, I'm also a member of the West Republican Town Committee, and the committee took a position against legalization, and we took it for about 3 or 4 reasons. One of the reasons was that there is still ample information to suggest that marijuana is in fact a gateway drug. Now, you're going to get supporters for this who are going to jump up and down saying that's not true. But the data that we based upon was a 2013 study by the Department of Health and Human Services, the United States Department of Health and Human Services, that suggests that basically established the fact that of all of the full amount of heroin and cocaine addicts that are out there, 70% of those addicts had disclosed that their initial introduction to the drug culture or the drug way of life came through the use of marijuana. So that's a big concern. It's not a pro forma or a fact that if you take it you're going to wind up addicted. But the fact is, those who have become addicted did begin that way. And then, as Jim just pointed out, there is a major concern, and I think this is where a lot of public awareness has not been focused on the increased levels of THC, which are in the contemporary form of marijuana. There is now the THC content, which is a very active ingredient to it, is 30% higher than it was, say, 25 years ago, when most parents, when they first maybe in college or whatever, were smoking it. It's completely different. And some of the studies that suggest, and I applaud Westford Academy for moving down this road, is that THC utilized by adolescents may have a significant impact on their intellectual development down the road. And that's something that early studies have indicated. I think more needs to be done, but I'm saying, why take a chance?
Well, what I would also kind of point out, it does seem a little paradoxical that we're trying to finally stamp out smoking of tobacco, correct, and yet we're now having kids smoking marijuana.
There's a lot of contradictions,
which seems a little strange here.
Yes, there is.
Wait, would you mind if I just add a little bit more to what Dennis has said? You know, we've adopted Project Purple at Westford Academy, which is the Chris Herron project. I had an opportunity last year when we had Chris come in to speak to our entire school and some of the parents at night. And what he said to me was really eye-opening. I said, Chris, how did this begin? He said, well, Jim, if you think it was about me putting a needle between my toes, out of the gate, you're wrong. My addiction began with blunts and a red Solo cup. So a blunt is the way that these kids smoke marijuana today. And he said, if people think it's not a gateway drug to the next level, please, believe me, it is.
Well, one of the things that was interesting is the rationale for people talking about a usage of this thing. I don't want I guess the famous saying is the slippery slope.
Yeah.
And I'm trying to ask, and maybe I don't really get into this debate with these people too much because I'm not a particularly easy debater on something that I feel passionate about, so I have to kind of step back. But I can't think of any other therapeutic drug that we've had that we made a recreational drug. I mean, it's yes, opium. All of the opiates that we had started off as therapeutic drugs. So my question is, people that talk about this is not a gateway, that we can make revenue off of it and so forth, do they really feel that way, you think, or are they just using that as an example of how we're going to slide this through? People will not pay much attention to it. And the reason why I'm asking is because we do have a predicate state, which is Colorado. And I think as the paper was talking about it, it's not as easy as you think once you go to recreational, because you have a registered, supposedly taxed thing going against basically street vendors, that it's all cash and so forth like that. So I'm just trying to look at what the four things are that really are important for people to understand about what this recreational legislation would do to us.
You want to go first?
I'm just gravely concerned about the message that it sends to our adolescents, Wade. The increased opportunities for students to have access and young adolescents to have access to this, I think is going to be an increased problem for our youth. And again, the MGH study, which I'm excited about, this opportunity will hopefully provide us with some data to support. I would hate for us to move forward with this legislation without proper science behind it to support. And so I'm vehemently against this particular bill, and I hopefully folks will hear this message that I think it's the right time for us to do some science, some studies behind this, and figure out what our next steps. Massachusetts is a very, very smart and forward-thinking state, and I would like for us to do, and for us to stay that way.
I would like to address the issue that you raised about the business end of it and the revenue, because I think there's an illusion here that resembles somewhat the arguments behind gambling. But let's start off with the premise. It's a business, so people buy a product. Right now, there is a very well-established illegal business that's going on in Massachusetts and throughout the country. We want to open up a business that's going to go and compete with this, all right? And hopefully the idea being is to draw everybody out of the black market, so to speak, and bring them into the active market so it can be regulated and taxed. So let's examine some of those premises, all right? The first thing is you have to give a product. Two big factors are going to affect the marijuana product. First is going to be how high are the taxes, and second is going to be what's the level of THC in your product, all right? If our taxes are too high, people won't buy the product. They'll stay with the illegal drug. If the THC content is too low, people will continue to buy the illegal drug, and they will stay, and they will ignore the open market. Now, this puts the state in a very interesting position. Are we going to sit here now and debate THC levels with the information we don't have about people's, with the effects it has on youth? We're going to start to toy with THC levels to make it competitive. I don't want to go there, and I don't think there's too many people, if they really think about that, want to go there either. Then there's the question of revenue and profit. So we bring in, as you mentioned, you alluded to it, there's going to have to be a significant regulatory apparatus that's imposed across the state if this is going to be effectively controlled. Now, that money is going to be collected from taxes. The problem is the federal government does not recognize this as a legal enterprise, which means FDIC banks will not collect it, will not hold it. Any bank that takes the money for proceeds is going to run the risk that it could be confiscated by the federal government if all of a sudden the policy in Washington changes. So it becomes a very risky business. It'll become predominantly a cash business. That raises all kinds of issues because now you've got massive amounts of cash being exchanged. You're going to run the risk of robberies. extortions, and talk about regulatory systems. If you've got an all-cash business and you're going to regulate it by the state, you are now in creating the conditions for a significant opportunity for corruption. And we don't need to go down there. We don't need to go down there.
I think we've gone through that with prohibition at one time.
Yeah, and I think you're seeing some of the stuff with gambling right now. It's having an issue. And to stop and think about this, as a society, we've addressed the idea of small amounts possessions. We've decriminalized it. So anybody with a son or daughter out there who's arrested with a small amount of marijuana is not going to have a record that's going to prevent them from getting a good-paying job or a future. The people who needed it for marijuana reasons, we've deregulated, decriminalized it for that. So now you can get it for marijuana. You can get it for any type of medicinal purpose you want. With the opioid crisis that we're having out there now, why do you want to go down and take the chance of expanding the supply, which will expand the usage? I just don't see that as a wise move for policy.
Well, Dennis, you bring up a very interesting thing about because you were in the dispensary committee.
Yeah. So was Jim. Mm-hmm. He was there.
I'm sorry, Jim.
It's okay.
Is that there was a medical reason that you had to have this. There's for whatever reduction of nausea and so forth, for cancer and so forth, and you could have a medical reason. You'd have a doctor give you that prescription, and it was somewhat controlled, just like the therapeutic drugs we've got. Makes perfect sense. That seemed to be almost really not the purpose of it. That really wasn't the purpose. It's like they wanted to go to legalization of marijuana to begin with, just so you could smoke it. So this was like their first step. That's a debate that we'll have for many, many years. The question I'm directing this to you, Jim, is the fact that we're all parents, and we can have anywhere from 2 to 4 kids, and it's tough to control them and teach them the right thing. And here's the laws and here's the line. You're in a very unique position in the fact that you have to deal with, I'm not sure exactly how many, 1,800, 2,000?
1,650 students.
1,850 kids in that building that you've got to not control, but say, here's right, here's wrong, here's the law, here's what you can do.
Right.
When you have stuff like this, where it's kind of this sliding thing, how, as an administrator of a school with your staff, keep it in control, I guess, is the best way to say it. I mean, it's like all the rules we had are here. Now, we may be talking about kids, but it hasn't changed yet. But yet, you've got the people that think they can always push the edge. Sure. I mean, how do you reach out to them, or how do you make sure they stay within the law?
Well, I think, Chief McInerney and I had discussions about this when it became decriminalized, and the chief saw a huge increase of situations out around the community and so forth. I think what I've tried to say at Westford Academy is to hold firm and to hold students accountable. And the message is that if you're bringing marijuana on school property and so forth, there are specific rules and guidelines and such. I've had some tough meetings over the last 8 years, Wade. Mm-hmm. I've had to deliver some serious news to parents and so forth. I think they're getting the message. Maybe it's pushing it outside of the school, and that's what my concern is that I'm concerned that at house parties and so forth, is there marijuana being used at house parties along with alcohol and so forth? I certainly don't want my son or daughters or my wife driving down the street with somebody using marijuana the same way as I don't want them driving down the street using alcohol and so forth. So I've got grave concerns again with that use. So what we try to do at the high school is just be firm, is to educate as much as possible with Project Purple and so forth, with our health curriculum, with our message, and quite frankly, the Westford Police Department with our school resource officer. We had a great relationship with Jeff Pavao. We have our canines come in whenever we can. Corey Pellwood, our canine officer, does a great job. So it really is a team effort. But on the other side of that, parents have to be proactive. Parents have to go out. You know what? You own that car as a parent. If you're finding Visine and you're finding things that look inappropriate in a vehicle, you need to check. You need to take a look. You need to look in your son or daughter's bedroom. Remember, it's your house. You're the one paying the mortgage and the taxes. I just think parents need to understand they have to be actively engaged. You can't put your head in the sand.
Well, to the engagement part of it, I think you make a good point, and Dennis, correct me here on the timing, but this legislation, the voting and so forth, is scheduled now?
The petition is expected next year, 2016.
Okay. My question, Jim, is can you give me a time frame of when the Mass General study would start and finish and there'd be some results? I mean, are we going to have some results before we get to a point where we vote?
That's tough to predict right now, Wade. I mean, our hope is that I'm going to get together with MGH over the summer to do some preliminary work and so forth. And again, my concern is that we may have to come back early next fall with the school committee and present some additional information for parents to keep parents educated. We really want to be transparent about this. So I would hope that the study would be complete by perhaps January or February next year, maybe a little bit later. I can't anticipate when the results will be, back in. It takes a lot to examine those results and so forth. So I'm hoping within a 2-year time frame.
Okay. So right now, as I understand it, Dennis, it's a petition that's being put through to the legislature or put on the ballot.
And I just want to say one thing. I'm glad this guy is the headmaster of Westford Academy. I can remember when he used to play football, and he was a hard guy to budge.
Okay.
And he's doing the right thing, and we should be very grateful for what you're trying to accomplish up there. Very grateful. 2016 is the year. And I think to follow up on Jim's comments, Boston Business Journal just did an article in which they've estimated that Massachusetts, 10% of the population is now addicted to some form of alcohol or drugs. Massachusetts has been plagued, like most other states, with substance abuse issues going back. All of us, I'm sure, if we sat down a minute, have been touched by the curses of substance abuse in some way through a family member, a parent, an uncle, somebody who's affected our lives. The question we're having is we're now seeing the opiate statistics, which always were around 200 deaths through heroin overdose, generally for many years, now shooting up to about 1,000 a year, a 46% increase in the last 2 years. I mean, that's a tremendous amount of increase. Somebody is moving this, and I know it's not all related to marijuana. A lot of it has to do with prescription medication. I'm very well aware of it. But I cannot understand the logic of going down this road knowing full well that if you expand the supply and you expand the usage, a certain percentage of that is going to break off and it's going to affect our youth and our children. And the costs are going to be, I think, very substantial. And I just think that people need to really reconsider that.
Well, as I said today, part of it, the question we have to ask ourselves is there an opposition to this movement?
Right here.
Well, okay. Every avalanche starts with a small little snowball.
That's right.
But I think Mr. Lucas in his editorial talked about this has been somewhat the third rail in Massachusetts politics over the last year. But with the mayor of Boston getting involved in this and people really starting to see this, do you see people now stepping up to maybe make it known that there's an organization or there's a place to put their voice in to say, wait a minute, we're not going to jump off the cliff until we've got really more debate and more information?
Well, I think Mayor Walsh made a courageous step forward. He's had his own history, which he's disclosed publicly, and he stepped forward. The governor has stepped forward and said he's opposed to it. The Attorney General, Maura Healey, is opposed to it. Governor Hickenlooper from Colorado, who's in the center of the storm himself, said if they had to do this over, he wouldn't do it. They thought they were going to get, I think their latest thing, they predicted $70 million worth of revenue to cover all their costs. They're down at about $35, $40 million. So it didn't come out quite the way they wanted. And a lot of it has driven use into other states. So there's a lot of things to be considered. I don't think this is the right time and the right way to go forward.
Well, beside Jim's thing about parents getting involved, I guess they're through your parent organizations in the school and working with the school. Dennis, is there somebody that the viewers should make their voice heard to? Is that?
Yes, I think everybody. If you're opposed to this, I think you should contact State Representative Jim Arciero. I think his number is being flashed on the screen. Just reference House Bill 1561 and basically explain that you're opposed to it. And I think that's a very important thing that you can do.
Okay. Well, this has been a great session. We're wrapped. Do you have any final words you want to share with us before we go?
I think I said it all.
Okay.
I just appreciate you having me. Thank you.
Okay. Well, we want to thank you. It's been great to have you on. I think you filled up a lot of the gaps for people. I know that this is probably not the last show. As we get more data, hopefully we'll have something we can share with people next year when we get through this situation. I have learned so much about what the study is. I feel much better about it than when I first read the headlines. So I think it's been a great session. I really want to appreciate you guys coming in today.
My pleasure.
And I want to close with, if you're ever confused, always get a second opinion. Thank you.